Good morning, and welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. I am Dr. Linda Snutzelar, Editor-in-Chief of the Journal. This podcast will focus on aspects related to the accepted article, which will be published in January 2024. And the title of the article is Characteristics Associated with Purchasing Sugar-Sweetened Beverages and Bottled Water Among U.S. Households 2015. And with me today are Doctors Armen Gazaran and Steve Onufrak. And I will tell you just a little bit about both of them. Armen is a health economist, researcher, and prevention effectiveness fellow with the CDC's National Center for Chronic Disease Prevention and Health Promotion. And Steve is a health scientist with CDC's epidemiology team in the Division of Diabetes Translation. Welcome to both of you.
Thank you.
Thank you.
In the next few minutes, I will ask a few questions to highlight your article, and I look forward to hearing your thoughts related to the topic of beverage purchases. We'll begin with Steve, and my first question is, why is it of significance as we look at public health to explore purchases and spending relative to beverages?
First of all, thanks for the opportunity to talk today. So for our study, we really looked at purchase of two different kinds of beverages, so sugar-sweetened beverages and bottled water. So why did we look at these beverages? Well, sugar-sweetened beverages are a leading source of added sugar in American diets, representing about half of the added sugar intake, associated with many different chronic disease outcomes, weight gain, obesity, diabetes, heart disease, and dental caries as well. On the other hand, so we have drinking water is a great way to reduce intake of sugar-sweetened beverages. But we're looking at bottled water. Why do we look at bottled water? Bottled water is also a great way to reduce sugar-sweetened beverages, but it costs a lot more than tap water. It also isn't fluoridated, so you don't get those added public health benefits of preventing dental caries as well. So why are we looking at household purchases and spending? Well, other previous research shows that the vast majority of both sugar-sweetened beverages and bottled water that is consumed is purchased in stores for consumption at home. So using this kind of data, this household purchasing data, it serves as a good proxy for intake data as well. And since we have data on amount of money spent on these products, it also lets us examine the economic burden that purchasing these products places on low-income families as well. So yeah, in our study, we were able to examine purchases of sugar-sweetened beverages and bottled water in a nationally representative sample of nearly 65,000 households. So we found about 90% of the households purchased SS sugar-sweetened beverages at least once during the year, and 70% purchased bottled water. And annual spending was $45 on average per person per year for sugar-sweetened beverages, and about $11 per person per year for bottled water.
What characteristics among U.S. households drive the purchase of sugar-sweetened beverages versus bottled water? And this question goes to Armen.
Dr. Snetzelar, thank you so much for having us and for the great question. I want to start by saying that the findings that we're discussing today are those of the authors and do not necessarily represent the CDC's or U.S. government determination of policy or U.S. Department of Agriculture's determination of policy. They should also not be attributed to Circana, which is the company that collects this data. So now let's dive back into your question. And generally speaking, we found that in 2015, married household heads, households with children under 18, and households living in areas with favorable conditions for healthy child development spent less on bottled water and sugar-sweetened beverages than their counterparts. We also found that household heads with college or postgraduate degrees, they spend less on both product categories than those with no high school diploma. Race and ethnicity were important factors as well. We found that Households with primary shoppers who identified as non-Hispanic Black or non-Hispanic Other spent more money on both product categories compared to non-Hispanic whites. But then on the other hand, non-Hispanic Asians spent less on sugar-sweetened beverages while spending the same amount of money on bottled water as non-Hispanic whites. Then the annual spending on SSBs was the same among Hispanics and non-Hispanic whites, although although Hispanics actually spend more on bottled water. And then, as you can imagine, household income and place of residence were also important factors, but they were only important factors for sugar-sweetened beverages and not bottled water. So households with higher incomes and households living in more urban counties had lower spending on sugar-sweetened beverages than households, with lower incomes or those living in more rural counties. And just what I really found interesting is that the groups that had the highest spending on SSBs were not necessarily always the same groups that purchased the highest amount of sugar-sweetened beverage calories. So I'll just give you a few examples. For example, um, even though Hispanics spend the same amount of money on SSBs as non-Hispanic whites, Hispanics purchase more calories from SSBs than non-Hispanic whites, and the difference was about 50 calories per person per day. Another example is households with children under the age of 18. They purchased about 80 more calories per person per day than households with no children. And then lastly, households in the Midwest purchased the highest number of calories from SSBs compared to those living in other regions.
Very interesting. Armin, another question for you. What would you say are 3 take-home messages from the research that you've done?
Thank you again for the wonderful question. I would say the first take-home message is that, Steve already mentioned that households spend on average $47 on SSBs, and this corresponds to about 210 calories of SSBs per person per day. And a large portion of these calories come from added sugars. So to put this into perspective, we know that the dietary guidelines for Americans recommend limiting calories from added sugars to no more than 200 calories. And that is for a standard, 2000 diet calorie. Keep in mind that our study only looked at sugar-sweetened beverages purchased from retail stores, and we did not include candies, cookies, snacks, other sweet products, or even sugar-sweetened beverages purchased from restaurants, cafeteria. The first take-home message is that sugar-sweetened beverages alone surpass the dietary recommendations for all added sugar calories combined. The second take-home message is that households with primary shoppers who are members of a racial or ethnic minority, and also households with lower socioeconomic status, spend more money on purchasing both sugar-sweetened beverages and bottled water than households with non-Hispanic white primary shoppers or households of higher socioeconomic status. You might ask why this is the case. While we did not study that question, we know from the literature that this might be due to tap water avoidance, preference for taste of these products, and other factors. And then lastly, which is also one of the novelties of this study, the third take-home message is that we found that children that are already at potentially higher risk for adverse health and economic outcomes were also most exposed to sugar-sweetened beverages in the household. So in other words, we found that all 3 measures, meaning, spending on sugar-sweetened beverages, bottled water, and the amount of SSB calories purchased, they were all negatively associated with the Child Opportunity Index. And this means that households living in counties with better conditions and resources for healthy child development spend less on SSBs and bottled water, and the purchased SSBs combined fewer calories per person.
Very interesting statistics. And the final question goes to Steve. And this question is, how might a practicing registered dietitian nutritionist use this information in, say, a daily session?
Yeah, sure. I mean, I'll go back to what I said earlier, and really emphasize that sugar-sweetened beverages are a leading source of added sugar in American diets and represent about half of the added sugar intake, and are associated with lots of adverse outcomes: weight gain, obesity, diabetes, cardiovascular disease. So substituting plain water for sugar-sweetened beverages is a great strategy to reduce added sugar intake. So they can also they can counsel patients on reducing their sugar sweetened beverage intake and substituting it with plain water. They can also encourage parents and caregivers to model healthy behaviors by drinking water instead of sugar sweetened beverages. And now specifically, regarding the study findings, I think they help to identify some of the high risk populations that may be buying more sugar sweetened beverages and spending more money on bottled water and such. Specifically as Armin had said, lower socioeconomic status households were spending more money on sugar sweetened beverages and bottled water. So we can also encourage clients to drink tap water rather than bottled water, to save money both, and to get those fluoridation benefits to help prevent dental caries as well.
Thank you. Very important distinction between bottled and tap water. Thank you. Thank you for adding that. So thank you so much for this wonderful discussion around what I think is an incredibly important and valuable concept, looking at sugar-sweetened beverages and then the alternative of purchasing bottled water. And I think the data that you provide is certainly a nice indicator of what can happen relative to reducing added sugar consumption. And as a part of the Scientific Advisory Committee for the Dietary Guidelines, I feel as though the data that you have presented in your article very much fits with that emphasis that we had on reducing sugar-sweetened beverages. So thank you so much for that. And just finally, thank you for being willing to be a part of the podcast today. And I so appreciate the time that you provided with us this morning.